In just a moment, I have the great personal pleasure to turn the gavel over to our new president, Dr. John Tomaszewski. But before I do that, I have a couple of words to say. And the next, what can I say? Now, everybody here who's a pathologist or a morphologically oriented lab professional, look at this slide and say, this is something bad. It's either squamous cancer or it's high-grade dysplasia. It doesn't really matter whether it's cervix or lung. The diagnosis is instantaneous. Everything you know is an instantaneous flash in the scene. Now, if you come from the University of Rochester or the Department of Pathologies in Cleveland, you can enunciate criteria to teach your residents why and how this is squamous cancer, not adenocarcinoma. But when John Tomaszewski looks at this same image, multidimensional streams of data appear in his mind. There's the morphometric, there's the biochemical, there's the infectious viral, and these all converge in a higher order thought process that yields personalized diagnostics for the patient. And it's this kind of higher order multidimensional thinking that is going to lead ASCP forward as we transition into this new era that we keep talking about of personalized medicine and genomics. I can think of nobody better to lead us than Dr. John Tomaszewski. And I welcome him to the stage as your new president.
Very good. Thank you. So this is a great day, and I am wowed. Let me start by giving some thanks. First, thank you to my wife, Jane, to my children, Jen, John, Chris, Rebecca, who couldn't be here, to my son-in-law, John, to my granddaughter, Gracie, to my sister, Claudia, to my other sister, Marianne, and to my mother, who couldn't be here, but you have supported me in all my ASCP volunteer work, and you've supported me in life, and I am grateful. Second, thank you to my close personal friends. Special thanks to Dr. Mike Feldman, Mr. Jim Emmerich, and Miss Barbara Brown, my best friend. It's really true that you do get by with a lot of help from your friends, and I'm thankful for that. Third, I want to thank my colleagues at the University of Pennsylvania. I've had many people who have brought me along as a physician. In particular, I want to recognize Dr. Virginia Lavolsi, who has been a long-term personal mentor. I wouldn't be the physician I am today, the pathologist I am today, without their support all along the way. And then finally, I want to thank the past presidents of the ASCP. I want to thank personally Mark Stoller. I want to thank Barb McKenna. I want to thank Lee Hoborn, who are recent past presidents. I've learned so much from you. I want to thank the board of directors. You have been my friends and my colleagues. I want to thank all the ASCP colleagues and friends. I want to thank, in particular, EVPs Blair Holliday and John Ball. I can't tell you how much you have taught me, and I would not be here today without your mentorship. Being elected president of the ASCP is without a doubt one of the greatest honors of my professional career. I've been blessed by so many gifts from you, my colleagues and friends. In large and significant ways, I have learned and developed with your help and because of your caring. I've been an ASCP volunteer since 1985, and in a very real way, you are my career family. This week I took a little bit of time and I reread some of the comments that some of our celebrated ASCP awardees have made over the years. I was looking for ways to phrase my gratitude, and I thought, boy, most people have said it better than I could. And here are some paraphrases from those past awardees. I am grateful to ASCP for providing me a network of support. I'm grateful to ASCP for giving me an opportunity to do the work that I love to do. I'm grateful to ASCP for accepting everyone into the lab as a contributing partner. I'm grateful to ASCP for giving me the opportunity to serve. I'm grateful to ASCP for giving me lifelong colleagues. And I am grateful to ASCP for helping me make a job into a vocation. I echo every one of these sentiments. I have been blessed by my volunteer years with ASCP, and I am truly grateful. So I've thought a great deal about what is important for me to say this morning to you, my professional family. At the opening of the Leadership Exchange part of this meeting, Dave Glenn made an elegant speech, and he talked about how labs were great and how you went from an okay lab to being a great lab. And he said, it's because of the people. It's always because of the people. So this morning, Mark, I am not going to talk about high-dimensional, multi-dimensional manifold learning. I am not going to talk about computational biology. I could if you want me to, but I'm not going to do that. I'm not going to talk about ASCP programs. I'm not going to talk about our strategy. I'm even not going to talk about our vision. I'm not going to talk about molecular pathology. I'm going to talk about you. So what I want to do is to focus on you, the members of ASCP, and I want to hold up for you a mirror and have you reflect on yourselves. I want you to reflect for a couple minutes on your professional selves and your place in the House of Medicine, and in point of fact, most importantly, your place in this world. So, Marcus said this, and I'll reiterate it, and we'll say it again and again and again. Our mission, ASCP's mission, is to provide excellence in education, certification, and advocacy on behalf of our patients, pathologists, and the laboratory professionals. And ASCP seeks to new ways to contribute to the public good, and we have focused on advocating for public health, developing international strategies to advance public health, developing educational programs based upon the best science and on the best practices, and in conducting health policy research. So I ask you, how are you doing? How are we doing? Are we fulfilling ASCP's missions? Are we contributing to the public good? No statistics here. Let me share with you a couple of stories about two ASCP members, and I'll let you be the judge. In the course, at the core of ASCP's mission statement, I think, is education. I've lived my life surrounded by dedicated educators and teachers. My wife is a teacher. My best friend is a teacher. Two of my children are teachers. I am amazed at their unconditional commitment to their students. I have watched many, many, many evenings of grades and preparation going on. This unabashed commitment to education is also a fundamental characteristic of ASCP members. So, I'm a surgical pathologist. Let me paint you a picture. Let me paint you a picture of one ASCP member who I believed moved from education to action, and on the way did a little credentialing. So Carol Moore, MLS ASCP, currently works as a quality assurance specialist in the International Laboratory Branch Global AIDS Program of the CDC. Before going to work at the CDC, Carol worked as a lab manager at Atlanta Children's Healthcare And not too long ago, while attending an ASCP leadership program, leadership exchange program, Carol heard a presentation, and the presentation was about global outreach. Inspired, Carol returned to Atlanta and looked into becoming an ASCP consultant. Carol, however, realized that it would be impossible for her to get away for 2 weeks, the usual length of an ASCP consultancy trip. So Carol instead applied for a job at the CDC International Laboratory Branch as a way to contribute. Carol was hired as a quality assurance specialist. Her main objective was to get the lab at the International Lab Branch accredited. After all, the people who are responsible for laboratory accreditation in Africa need to practice what they preach and be accredited. So in a little over a year, the ILB lab had passed CAP accreditation. And while other labs at the CDC are working towards that accreditation, the ILB lab is the only accredited lab at the CDC. Carol is a Remember member, a passionate med tech who fulfilled ASCP's mission by moving from education to action. You might also consider this picture of an ASCP member bringing together all the pieces of what we talk about: education, patient advocacy, and outreach. I call this picture from consultant to vocation. Ian Lamo first went to Swaziland in May 2008 as a consultant in a phlebotomy training program. Ian proved to be a great teacher. He was enthusiastic, able to adjust to his audience, and passionate about good results, starting with good samples. Ian's experience in Swaziland inspired him to do more to directly help patients in the HIV pandemic. A few months later, Ian applied for and was accepted to a one-year nursing program. Although he couldn't travel during his program, Ian served on the monitoring and evaluation work group. This work group developed Global Outreach's M&E Workshop, a 5-day training program to help in-country partners improve their skills at program evaluation. Ian returned to Africa in May 2010 when he facilitated the first M&E workshop in Tanzania. Today, Ian uses his skills as a medical lab scientist and as a nurse in his work as a research nurse and study coordinator for HIV vaccines and microbicides. Ian summarizes in this quote from him: "Needless to say, my work with ASCP Outreach and each of you has inspired my continued interest in HIV/AIDS work and unmet medical needs. It's nice to bring all the pieces together." Ian put all the pieces together and moved from being a consultant to having a vocation. In 2007, Dr. Greg Henderson gave the keynote address at the ASCP annual meeting in New Orleans. This was a time when New Orleans was struggling to recover from Hurricane Katrina. Now, Dr. Henderson is a young pathologist who was lodged in New Orleans during Katrina, and ended up doing a lot of primary care medicine under very, very severe conditions. I was in that audience in 2007, and for me, his story was riveting. But what I remember most about Dr. Henderson's talk was an invitation that he extended to the audience. And I need to quote from Dr. Henderson for a minute or two. Quote, I want you to think back now, perhaps a long time ago, to a time when you made a defining choice in your life. Think back to the time when you chose your profession, your vocation in life. At that critical crossroads, you didn't choose to be a stockbroker or an investment banker or a politician or a restaurant owner or a lawyer. Actually, he said ugh after a lawyer. You chose, you chose a calling that puts at the center of your life, taking care of people who are in their worst state. You committed your life to a profession that makes them well again if you can, and if you can't, to providing them with compassion, comfort, and dignity. He continued, we all go into medicine with a flame burning inside of us to take care of people. In medical school, this flame usually rages wildly. In residency, it's usually focused and brought under control. The oxygen that keeps the flame burning is the experience of direct gratification from our patients. Over their careers, most physicians find their flame waning at times, but typically some patient experience blows a wind on their flame and stokes it again. As pathologists, we've chosen a pathway that by its very nature requires us to live in an environment that is relatively depleted of this oxygen. So we are at great risk for our flame being reduced to a small ember or going out completely. Dr. Henderson then spoke about how his flame got reignited during the Katrina experience and his work doing this really primary care, trying to take care of people in the middle of the French Quarter with absolutely no resource. He went on to note about all the good work that ASCP volunteers were doing in global outreach, very similar to the stories that I told you about Carol and Ian. He observed that to a person, each of the staff members and volunteers who engage in this work have painted a picture of indescribable gratitude and sheer joy at their experiences in which they returned with far more than they gave. He said, I suspect that there is a quality to this experience that made them feel the fire in them start to burn again. Maybe the great truth in all of this is that the best way to rekindle your own fire is by lighting someone else's. So today, I want to tell you, my professional family, the world needs you. Your work is at the very center of medicine. Your work is more important than you will ever know. Your work is quite literally the driving force that will be behind the 21st century medicine. The world needs your professional skills, which each and every one of you have developed. There is nothing that any one of you do in your professional life that isn't in short supply in this world. The world is quite literally dying for your talents. The world needs you desperately. So my message to you today is quite simple. Find the oxygen that makes your passion for your vocation burn brightly again. Give freely of yourself. You will give back much more than you give. I hope this year to serve you well as your president. I am humbled by this honor. I am intent on telling the good news of the ASCP story. I look forward to working with each and every one of you and in spreading the word of your indispensable value to this world. Thank you.